So now that we've gone over the summary of these different interventions, what I'm going to ask you to do is rank order the priority that you would like to implement these interventions for your treatment plan. Cool. So what you're going to do is, yeah, great, got pens?
Thanks.
You're going to put a number 1 next to the intervention that you think is the most important, that you would like to implement first, and you're going to put a 1 next to the intervention that you think is most important. What we're going to do at the end is we're going to average those totals together. The lowest rankings will be implemented first, and then the highest rankings will be implemented towards the end of the treatment.
So like 1 through 5?
Exactly, 1 through 5. So the first one you want implemented, your first priority, you're going to put a 1, and then a 2, 3, 4, 5.
You got that?
Yeah.
Okay. I just like give this to you now?
Perfect, yep.
Okay.
All right. Okay, so Chelsea, you put stimulus control as your number 1 priority. Can you tell me a little bit about why you put that one first?
I just don't want her to be hanging out with like that group of friends anymore immediately.
Okay, that can be understandable.
Mm-hmm.
And you put reciprocity awareness as your first choice. Can you tell me a little bit about why that was your first priority?
Wait, which one was that one?
Reciprocity awareness was the building family relationships by exchanging, appreciation and what you like about what the other person does for you.
Oh, well, I don't know. I think we just like fight a lot and stuff, and so I just want to get past that.
Okay, so it sounds like you were a little unclear about that one, but you still put that one first. Do you think that one's the most important one for you?
Yeah, I think so.
Okay. And then second, you had the self-control. And it looks like, Chelsea, you also had the self-control second. Why do you think that might be also important to implement pretty early?
I just like the idea when you were saying controlling urges. That's like a good skill to learn.
Yeah, I think that, I want to be able to overcome that, like when I get the feeling like that I want to go do this, and like I want to be able to stop myself and...
Okay, yeah, so you want to be able to control those urges, it sounds like. All right, well, I'm going to go ahead and add them up here. So we have for the first one a 1 and a 4, so that equals a 5. And then it looks like for self-control, you put a 2, you put a 2. So we're going to add them up, that equals 4. Improving family relationships, you put a 1 for that one, and you put a 4, so that's also a 5. For positive request, you put a 5. Joy, and you put a 5 as well, so that's going to be a 10. And for job getting skills training, that you put a 3, and you also put a 3, so that's going to be a 6. So I'm going to go ahead and average these together, and we're going to implement the lowest number ones first. It looks like your lowest number was self-control. You both put that as a number 2. So we're going to go ahead and implement that first. How do you feel about that one?
Awesome.
Great. The next one, you actually have a tie between stimulus control and reciprocity awareness. So remember, stimulus control was going to be the restructuring the environment to decrease your chances of using drugs and being involved in situations that have, you might get in trouble. And then the reciprocity awareness, like we said, was the improving family relationships with the exchange of appreciation. So which one do you think you might like to implement as your second intervention?
I guess the environment one.
Okay. And do you agree with that? Because you did put that one as first.
For sure.
All right, perfect. So we're going to go ahead and implement that second. And then it looks like your next lowest one was the improving family relationships, so the reciprocity awareness. We're going to go ahead and do that third, followed by job getting skills training, getting you that job that you're looking for. Fantastic. And then last, we're going to end it with improving those communication skills with positive request. So as the therapist, I might decide to kind of change this at my discretion based on what you might need at that particular time. And of course, these interventions, the order of implementation can be changed by you guys as well. So based on what we need at that time, you might decide that we really need a positive request in one of the sessions. So we might go ahead and implement that a little bit earlier. But just for our treatment planning, we're going to stick with this for right now. Do you have any questions?
No.
All right, perfect. I'm glad we were able to get that treatment plan done for you guys.
Yay.